Patriots don't always wear uniforms. And today, we get to see one of those individuals who doesn't have a uniform on, but is as great a patriot as I've ever had the privilege and the honor to know, Arnold Fisher. So, Millie, thank you very much. It is a pleasure to be on your facility, and everyone else here who has made today possible. Those of you who do wear the uniform, I don't think there's a greater way to volunteer in this country. I tell kids on a regular basis, you can join the Peace Corps, you can join the Marine Corps, or anything in between. Just find your place to give back to the greatest country in the world. That's what today is all about. It's my profound honor to be here, to be a part of this as we break ground on a facility that will improve and will save lives in the years to come, as our men and women in uniform continue to serve in some pretty dangerous places around the world. They need to understand. They need to understand that in no uncertain terms, we are going to be here for them. Facilities like this are going to continue to be built across this country. The center itself is a community. It is a community that allows these individuals to have their needs taken care of, and frankly, that we as a country are rushing to meet. That's always been the Texas way, General, and part of our ongoing tradition of neighbor helping neighbor. So this is pretty average work, actually, for this state. And Arnold, I want to say thank you for being a part of this, and everyone in your organization, your sons, your family. This is a vital mission that we have undertaken. And you, sir, I want to say again thank you for being as urgent about it, as being profound, as being so candid. In Texas, we enjoy a very special bond with the men and women of our military. Whether you were born here, or Sergeant Kenny, you got here as soon as you could and have made it your home over these last 10 years. We take great pride in all of them. We share the joy of their victories. We're part of the depth of their pain when it occurs. We care for each of them as members of our extended Texas family. And just like families everywhere, that involves a commitment for caring for them, not just when they're on active duty, but after they come home. This facility will certainly play a large part in our meeting our obligation for our nation's heroes. But as this unfolding scandal with the VA demonstrates, we're coming up short in too many areas. Whether it's reports of fraud or bureaucratic runarounds, endless waits for care at VA facilities, including right here in this state. That is just unacceptable. While reports out of Washington indicate that they are, in fact, working to have relief on the way. In Texas, we're taking some steps to provide what assistance we can until this crisis is addressed. To start off, we're expanding our Texas Veterans Hotline with staffers who are trained to deal with the VA. These staffers will serve as guides to the all too confusing and all too complicated VA bureaucracy. We're going to help veterans understand their health care benefits and options. For the most urgent cases, these staffers will connect veterans to the Texas Veterans Healthcare Strike Force. These are individuals who work directly with the VA to help veterans get the answers and the care that they need and they deserve. There's an 800 number. It's 1-800-252-VETS. 1-800-252-VETS. Now, secondly, we've reached out to a number of hospitals, public and private hospitals, and healthcare networks, including Baylor Scott and White, Houston Methodist, Christus Hospitals, University of North Texas Health Science Center, and the University of Texas system. These institutions are willing to work with the VA to expand the number of treatment options for veterans waiting in line. With VA approval, the providers can begin treating veterans until this crisis is resolved. It's going to open the door for numerous new options for our veterans to receive care. I sent a letter to the acting VA director, Mr. Sloan Gibson, and we outlined this plan to him. There is certainly a permanent fix for this problem. It needs to be implemented, and it needs to be implemented quickly. And I remain hopeful, faithful, that Congress will, in fact, do the right thing and do it quickly. But until that happens, this temporary option can help reduce substantial pressure on the veterans who have earned, through their valor and their dedication, the very best care that we can provide. Providing that level of care is what the Intrepid Center is all about. In the years to come, this center will stand as a reflection of an unwavering respect and ongoing commitment to those who wear the uniform of the United States of America. God bless you, each of you, for what you do and what we will do in the future.